Telehealth. We are delighted that you have chosen to join us today. GPT offers free monthly webinars and CEUs. You may register for upcoming webinars on the GPT website under the Media tab. If you missed one of our previous webinars, you can also find those recordings on our website. Keep in mind that CEUs are only available when viewing our webinars live. Before getting started, let's go over a few housekeeping items. We will spend a few minutes answering questions at the end of the presentation. Please type your questions in the Q&A box located at the bottom middle of your screen so that your questions can be answered at the end of the presentation. For those of you interested or in need of continuing education hours, this webinar offers a free 1-hour CEU credit through the University of South Alabama Office of Continuing Medical Education, to which you may obtain after completing the survey that will be emailed to all in attendance. For those not in need of CEU credits, we ask that you also complete the survey, as all feedback is much appreciated and helpful when planning future webinars. At this time, I'd like to share a little information with you about GPT. Global Partnership for Telehealth is a nonprofit telehealth organization with a focus on consultative services, turnkey hardware solutions, and our easy-to-use telehealth platform, Pathways. Our organization was founded in 2004 to build a telehealth network in the state of Georgia. That quickly evolved into our current mission to leverage telehealth technology for the benefit of all. Our mission is to enable healthcare everywhere with the solutions we offer and our values of integrity, expertise, passion, and innovation. Be sure to follow Global Partnership for Telehealth on Twitter, Facebook, and LinkedIn to stay up to date on our webinar series, as well as other important information as we continue to leverage telehealth across the globe. Now, it is my pleasure to introduce our speaker and presenter for today, Dr. Valerie Morrison. Dr. Morrison hails from the Sunshine State, growing up in Ocala, Florida. She attended the University of North Florida, where she received a Bachelor of Science in Nursing and her commission as an ensign in the United States Navy Nurse Corps in 1991. She also holds a Master of Science in Management from the Naval Postgraduate School and a doctorate in Business Administration from North Central University. Dr. Morrison retired in August 2020 from the U.S. Navy as a captain, serving 30 years and 6 months on active duty. In her distinguished career, she served in a variety of clinical and leadership positions, to include Chief Nursing Officer of Walter Reed National Military Medical Center, where she led a team of over 1,200 nurses to the historical achievement as the first Department of Defense medical center to attain the American Nurses Credentialing Center, ANCC, Pathway to Excellence designation. In June of 2020, Dr. Morrison returned to the University of North Florida as the Director for Student Health Services, with oversight of a 10-room ambulatory care clinic providing diagnosis and treatment of illness, injury, and emergencies, women's health, immunizations, x-rays, laboratory, and telehealth services on behalf of 17,000 plus students. Dr. Morrison serves as the chairperson for the American Nurses Credentialing Center Commission, ANCC, on Pathway to Excellence. She is an ANCC board-certified advanced nurse executive and a Society for Human Resource Management senior certified professional. She holds certifications as an executive coach and a healthcare leadership coach through the Center for Executive Coaching and Diversity, Equity, and Inclusion in the Workplace through the University of South Florida. She is a fan of 30-day high-intensity bodyweight challenges and yoga, and listening to podcasts and audiobooks. She is married to John Morrison Jr., and they have 2 teenagers, Hannah and Jonathan. Before I welcome our speaker, GPT would like to learn a little bit more about our attendees. I'm going to launch a quick poll and give you some time to answer a few questions. Okay, You should see that poll up on your screen that has been launched. If you could quickly answer those. Hopefully everyone has had the opportunity to answer those poll questions. And now I would like to welcome our speaker and presenter for today, Dr. Valerie Morrison. Dr. Morrison, thank you so much for being with us, and I will hand it over to you at this time.
Good afternoon. I'm Dr. Valerie Morrison, and I am the Director for Student Health Services at the University of North Florida. It is my honor to be here today to present to you a presentation entitled Best Practices in Telehealth Workflow, Lessons Learned on the Fly. I'd like to start out by saying I have no conflicts of interest to disclose related to this topic. There are three main learning objectives. First off, the learner will be able to describe the importance of team collaboration in designing telehealth workflow. The learner will be able to identify workflow areas of consideration that occur before a telehealth appointment, during a telehealth appointment, and after a telehealth appointment. And finally, the learner will be able to apply lessons learned by us at the University of North Florida Student Health Center in the design and implementation of telehealth workflow, avoiding common project implementation challenges. The University of North Florida is located in the heart of Jacksonville, Florida, and serves a population of approximately 17,000 students. As you see from the slide, our fall 2020 student enrollment for undergraduates was 14,662. We know that 38% of our students are from Duval County, and 55% are students that are from other Florida counties. Student Health Services itself is located in the heart of the campus. We have a 10-room clinic and a treatment room with capability to perform CLIA waived laboratory services and x-rays. We are staffed with an administrative director, a medical director who is a primary care physician, nurse practitioners, registered nurses, a radiology technician, business manager, program assistants, and program specialists. Our telehealth adventures began in March of 2020. While we were interested in the concept of telehealth, we had not explored its use in great detail until the university shut down. Like many of you, we initially thought the shutdown would only be for a couple of weeks. When the reality hit that it was going to be much longer, we needed a way to meet the healthcare needs of our students who were all moved to virtual classwork. Our clinic had a traditional continuity of operations plan. However, COVID-19 brought about an unexpected challenge. The pandemic forced our clinic to consider technology solutions that we had not considered previously. This sentiment was shared by others. From a December 2020 white paper by VMware and MIT Technology Review Insights, 3 in 10 healthcare leaders felt their plans were less effective when attempting to cope with the pandemic. Enter Telehealth Now. Pathways, by Global Partnership for Telehealth, was one company we considered for our telehealth program. We chose Pathways because a sister unit at the university was using Pathways with very good success. We did look at other virtual platforms for our telehealth, but we had concerns regarding patient privacy. Ultimately, we did end up contracting with Pathways in the May of 2020 timeframe. According to the 2020 Telehealth Benchmark Survey performed by Becker's Hospital Review and Teladoc Health, 92% of hospitals and health systems had telehealth programs in place or near-term implementation plans at the start of 2020. and 94% of respondents indicated that telehealth was a long-term strategy beyond COVID-19. Key to implementation of Pathways telehealth platform was working from the beginning with external and internal partners to the Student Health Services Clinic, such as the University Information Technology team. They handled the project from an IT perspective to ensure IT security, interface with other programs, network access, and single sign-on, etc., were all thought about, reviewed, and put into the process for a successful implementation. We also knew that implementing telehealth was aligned with the university's guiding philosophy of being student-centered, innovative, inclusive, and providing excellence. In the 2020 Telehealth Benchmark Survey, alignment was noted as being critically important to making telehealth efforts successful and sustainable. In fact, 69% of respondents indicated that the project must align with the organization's objectives. Here you see the university's goal-based framework for student success. Student health and well-being directly impact the student academic success. In alignment with the university framework for student success, implementing telehealth supported, first off, the goal of student experience by promoting health and well-being of our students by providing both a needed service through an environment that fostered physical and emotional resilience. Secondly, the goal of academic and administrative excellence by providing service excellence. And finally, the goal of organizational effectiveness by transforming technology to meet the current and future needs of the students. The first major lesson that you must know about implementing a telehealth program is that it requires a team. Dan Rockwell of Leadership Freak wrote an article in 2020 on how to build teams that row together. And in his article, he outlined 4 main lessons. First off, there is one boat, but multiple team members. Secondly, all the team members need to understand the destination. Third, once they know the destination, they need to learn to row in the same direction. And finally, we need to learn to respect each member's contribution to the team. So when thinking about a crew team, telehealth represents the boat. There's only one of them, but it takes multiple team members to make it do anything. Secondly, if the boat isn't properly manned, it'll just float in any direction that the waves take it. You have to know what your destination is and purposefully create the team who will get you there. And that team is going to be made up of multiple team members, from the clinicians to the registered nurses to the advanced practice registered nurses, from the front desk appointment managers, IT, and so many others. Third, the team must all understand the destination and how to row in the same direction. Telehealth is a skill that must be learned. Everything from learning how to manage the technology to guiding the students on how to manage the technology to performing virtual assessments and more. Fourthly, everyone on the team plays an important role to the patient flow, and their voices must be heard and included in telehealth implementation for it to succeed. According to the American Medical Association Telehealth Playbook, as you plan for implementation, some of the initial questions that need to be considered include: will the platform integrate with your electronic health record? How will you document telehealth visits? How will these visits fit into the schedule? Is there office space needed for telehealth visits? What equipment will you need? Computers? Cameras? How will you market this service? And how will patients make appointments? So let's begin by identifying our team. These are just a few of the team members at Student Health Services. As I mentioned before, internally, you have clinicians, RNs, the appointment managers. Everyone had to understand the workflow for each role, and we needed to address any issues of competency using telehealth. Externally, we needed to work with IT and IT security, but most importantly, we also needed to work with the students. Once you've identified your internal and external stakeholders, you also need to understand the destination. So in fall of 2020, we knew that 70% of coursework was going to be online. We were going to have a limited number of on-campus residents. There were many unknowns regarding potential infection rates, and things were changing every day. There was a concern about asymptomatic COVID positive students, and we wanted to make sure that we protected our clinic staff and other patients within the clinic. We ended up with a little under 3,000 students living on campus in the fall, spring of 2020 and 2021, and approximately 36% of our classes were face-to-face. When you're trying to define your destination when it comes to telehealth implementation, you could use a narrow or a broad focus. Using a broader focus, it became overwhelming deciding what types of patients we would see through telehealth, and more importantly, when understanding the role of each member, it especially became challenging to figure out how our front desk appointment managers would be able to discern who was appropriate for a telehealth appointment and who wasn't. A narrow focus was COVID symptoms, upper respiratory infection, sore throat, cough. Putting those together, our destination goal became keeping students outside of the clinic who could potentially be COVID positive while offering telehealth as a means for healthcare access for our virtual learners. Now that we had a good understanding of our ultimate destination, we had to get everyone rowing in the same direction. This was going to take reviewing the telehealth workflow process from each member of the team's perspective, from before a telehealth appointment occurs, during a telehealth appointment, and after a telehealth appointment. So let's review some of these considerations, starting with what to consider before the visit. The AMA Telehealth Playbook identified several questions. First off, we need to review our scheduling protocols. What are telehealth appropriate visits? How will we put appointments onto our schedule? How will we educate the patient on telehealth? How will patients be reminded of telehealth appointments? Who sends those reminders? And who will answer telehealth questions? We also needed to ensure that the care that we provided was within the state of Florida, where all our clinicians were and are licensed. Being a member of a state university system, we are covered under sovereign immunity for our liability. So let's break this down even further. Scheduling protocols. Under a broader definition of who we would see, things got very complicated. Our non-clinical front desk staff needed to know what was and wasn't appropriate for telehealth without asking detailed clinical questions. So we decided to reverse engineer this issue. It was easier to say what we wanted to see in the clinic, which made all other visits easier to appoint. We built in a process as well for assistance when questions came up. So if there were ever a question regarding putting a patient into a telehealth, they would forward the call to the nurse. Or if the student that's calling has abdominal pain, allergic reaction, or difficulty breathing, those would also be referred to the nurse to review so that we made sure that they got the right visit. Now, With almost a year of experience with telehealth, our idea on what had to be seen in the clinic is certainly shifted. And we're excited about the opportunities on how to utilize telehealth to help us with access. So let's talk about scheduling. Initially, we wanted to give ourselves enough room to work through the telehealth workflow. So we changed our 20-minute appointments to 30-minute appointments. That gave us the extra time that we needed to practice our workflow and to refine it. This worked well. However, when you go from 20 to 30-minute appointments, you do decrease overall access to care. This did not end up being an issue for us since our total number of visits went down due to the pandemic. However, as we have improved our workflow and in anticipation of fall of 2021, we have changed our appointments back to 20-minute appointments. Our goal is to ensure that we have the widest available access for our students. So initially, we set up our appointment schedule so that our clinicians rotated where they would have a half a day of telehealth in the morning and a half a day of in-clinic appointments in the afternoon. We did this initially thinking that telehealth would end up being somewhere between 40 to 50% of our appointments. In reality, what happened was that telehealth was only about 25% of our appointment. And so the person who had telehealth in the morning did not have as many scheduled appointments on their schedule as the person who had in-clinic appointments. This created an inequity that we needed to figure out a way to balance the workload. We also thought that any student who tested positive for COVID needed to have a telehealth appointment. But we quickly learned that that was not necessary, as most students did very well with their COVID infection. We would, if a student was not managing their symptoms well, we would then see them via telehealth. So going back to the inequity, once we realized this inequity existed, we decided to book telehealth at any time in the schedule. This created new problems, issues in students calling in late for their appointment, nursing having technology changes, delaying their assessment and transfer to the clinician, and more. It was also very challenging for the clinicians to go from an in-person visit to a telehealth back to an in-person visit. So we changed it again. Still using 20-minute appointment blocks, we currently schedule telehealth appointments at the top portion of each block. So here you see, I would place a telehealth appointment in this first block or this second block, in this first block or second block, in this first block or second block, or finally this first block or second block. And the remainders would be for in-person appointments. That way, you can end up with 4 to 8 telehealth appointments mixed with 12 to 16 in-clinic appointments. We also began inviting the students to their telehealth appointments 15 minutes earlier than their scheduled appointment. And this gave time for us to manage any technology issues that we had and for the nurses to complete their assessments and to transfer the student from the waiting room to the clinician's room. In the category of what to consider before the visit is also providing care where licensed. As I previously mentioned, our clinicians are all licensed in the state of Florida and can see patients located in the state of Florida. So our consent forms have the students attest that they are in Florida for their care. But it also uses a geo IP location to validate their location. And that has been greatly assisting to us. We were interested in pursuing telehealth in Georgia under their Emergency Practice Act, however, never completed the work toward getting this. Understanding that 93% of our students are from Duval or other Florida counties, that made requesting emergency licensure in Georgia a lower priority. For liability, being a part of the state university system, as I mentioned before, they are covered under the sovereign immunity. We also had to consider patient engagement and education. There was the issue of telehealth intake forms. Now that the students were no longer coming into the clinic in person, we needed a way for them to complete necessary paperwork, consent forms virtually. We utilized a Qualtrics survey to complete our intake forms, but that created another workload. That additional workload was given to our front desk personnel who downloaded the intake as a PDF file and then uploaded it into the Medicat record. Ultimately, we are in the process of implementing a patient portal. And so that workload will go away and the students will, the paperwork that they complete ahead of time will go straight into the electronic health record. So in doing this, even though it is an additional workload for our front desk personnel, it is training our students to complete the paperwork ahead of time and shifting that culture of coming into the clinic, doing the paperwork then. Because even if they're coming in person, we will want them to complete their paperwork, intake paperwork via the patient portal prior to a telehealth or an in-person visit. We were very fortunate to also have a PR campaign class reach out to Student Health Services with the desire to assist us with our marketing. The class worked to review our current marketing processes and provided us recommendations on how to update our website, social media sites, and other handouts. And they provided us with tips on how to educate our students on our services and COVID-19 efforts. Part of this campaign was also shaped to provide us with recommendations on how to market telehealth to students. We currently market through our Student Health Services website, our Facebook page and LinkedIn pages, and my goal is to hopefully have a federal work study program student to come in and be our PR marketing person and to manage our social media and other marketing materials. So what specifically did we tell our students? We would drive them to this website that you see on the slide that discussed what they needed to do to prepare themselves for a telehealth appointment. And we wanted to manage their expectations so as to have the best possible telehealth appointment. So first off, we said, please choose a location that is quiet and will maintain your privacy. Do not call us while you are driving. There were several students who did, and we would kindly ask them to reschedule their appointment. We also did not want them walking or skateboarding while they were trying to do their telehealth appointment. They needed to understand that this was still a medical appointment and one that they needed to be able to engage and concentrate in the dialogue. We asked them to write down their symptoms and how long they had had them. We also asked them to make a list of any questions that they had, and if they had any medical devices, such as a thermometer, a blood pressure cuff, or even a smartwatch for pulse, if they could have those available, then we would have a way to get vital signs on them, even though we were doing a telehealth visit. Now that we've reviewed some of the aspects of what to consider before a visit, let's talk about what to consider during a visit. Again, the American Medical Association's telehealth handbook says we need to think about how to handle the patient intake and rooming of the patients or getting them to the clinician for review. How are we going to communicate with the patients? and we need to support patients and clinicians with troubleshooting. So reviewing how our patients checked in, we did use that Qualtrics survey for them to do all their intake forms and consents. We started off sending the text or email to the student on the day that they made the appointment, but quickly learned that it got lost. And so ended up sending the text or the email the morning of their appointment instead. Then it was fresh on their mind that they needed to enter into the virtual waiting room at the time the text stated. We did have to set up a separate office for our nurse telehealth. All of our clinicians have private offices that are good for telehealth, but we needed a space, at least one space, for nurses to do telehealth. We did find, and we had to communicate with the students that using cell phones or wireless earbuds created some technology issues. And so we promoted the use of laptop over cell phone. The cell phone battery seems to drain very rapidly when in a telehealth appointment. We would let them know if there were IT issues after 1 to 2 attempts in trying to fix those technology issues, that we would call them back and finish the telehealth appointment via the phone. And that allowed us to maintain the appointment schedule and not get too backed up. So important to this is that supporting your patient and clinician troubleshooting. And so for us, SOS sounded like this. Ryan, I have no sound. Ryan, I have no video. Ryan, I can hear them, but they can't hear me. Ryan. Ryan was truly our lifesaver. He became our identified staff super user. He was knowledgeable regarding the program, and he knew who to contact when issues came up. And he was also the person we called when we needed to troubleshoot. So Ryan's position was originally a part-time position, but I quickly realized that we needed full-time support with the number of IT programs and processes that we were implementing in our clinic. And I would greatly suggest that you have somebody on your staff that can help you when you're implementing telehealth, e-prescribing, and a number of other technology solutions. Now that we've reviewed what to consider during a visit, let's also talk about what to consider after the visit. The AMA telehealth implementation playbook also says to think about these questions. How are prescriptions or follow-up tests ordered? How are follow-up visits conducted? And how is feedback on the telehealth process collected? We implemented an e-prescribing platform at the same time of implementing telehealth. That's the reason for Ryan. This allowed our clinicians to write prescriptions for students throughout the state of Florida without them having to pick up a paper script. We used a satellite clinic for COVID-19 testing that was located within the residential life dorms. This dorm was also where we would place students who needed isolation or quarantine. And if we had a student that needed a rapid COVID or rapid flu or rapid strep test, we would send them to the satellite clinic for testing. Our clinic does not bill for insurance at this time, so I won't discuss telehealth coding, but that is an important item for you to consider after a telehealth appointment occurs. Now, since we are aligned under the Brooks College of Health, we are very fortunate to partner with the School of Nursing in evidence-based practice projects. We had a doctorate of nurse practice student assist us with data collection to evaluate our telehealth process. And this is what we found. First off, the majority of telehealth users were 18 to 24 years old and female. All the students were full-time. The majority were white, non-Hispanic, in undergraduate year 3 or 4. "65% reported that this was their first time using telehealth for their primary care and chose it based upon convenience or due to COVID-related diagnosis." Now, in a report by GE Healthcare Consulting in mid-2019, only one in 10 persons reported ever using telehealth services. And by March 2020, 73% of respondents said they would consider using a telehealth service to be screened for COVID-19, while 60% said that the pandemic has increased their willingness to try virtual care. So we felt that our statistics were in alignment with this finding. We also found that 81% of respondents reported that the telehealth visit resolved their complaint. While 92% of the respondents rate the quality of telehealth as good to excellent, only 67% felt that it was just as good or better than a traditional visit. So there was still this desire to meet with your clinician face to face. And really, since they had all their classes online, we really couldn't blame them for wanting to come in to see their physician or advanced practice nurse face to face. And that really explained to me why only about 25% of our appointments ended up being telehealth. 84% of our respondents reported that telehealth services helped them deal more effectively with their problems. We also found that 88% reported being mostly to very satisfied with the services they received, and 87% reported that telehealth services met most, if not all, of their needs. We were excited to learn that 84% stated that they were mostly to very satisfied with their telehealth visit, and that 92% would return to student health services for their care. So the fourth item that was mentioned in implementing telehealth was respect for each member's contribution. As we talked about before, the team is so important to ensuring that you row that boat in the right direction. Everyone from the front desk appointment managers, the nurses, the clinicians, the labs, the billing, the students. The appointment process, as I mentioned earlier, we began by sending texts and emails the day that they made the appointment, and then quickly shifted to the day of the appointment so that it was a fresh reminder to the student that they had an appointment. We also needed to make sure, so this is where a little more workload occurred, and we were so appreciative and thankful for our front desk appointment managers for sending out those text and email messages, for also uploading the telehealth consent forms and pre-appointment information from Qualtrics into the electronic health record. The nurses needed to complete their nursing assessments, and so they would call the patients the evening. For patients coming into the clinic, they would call them to do COVID screening. For patients via telehealth, they would review the information that was uploaded and begin the note in the electronic health record before passing the patient to virtually to the clinician. And then the clinician would complete the medical assessment and close the note. And then it began, we began to understand, how do we create a feedback loop back to the nursing team if labs or procedures were required. We're really happy that now the telehealth service, the process can be sent back, the student can be sent back from the clinician back to the waiting room in order for these things to happen. Working with the student, we needed them, and we continue to try and shift the culture so they understand they need to show up on time, They need to be in an appropriate environment for the call, to try to use their laptop instead of a cell phone. And our marketing will continue so that we can expand our telehealth access. So a big thing for this was training. We brought the staff back on board 2 weeks before the fall classes started, and we kept our social distancing requirements, but we used that time frame to test and train on the telehealth process, refining it as we built it. We created telehealth scenarios, and we practiced being mock patients, as well as practice being the nurse or the clinician. We made it fun. We used the power of the internet as well, using YouTube videos on telehealth best practices, such as a Stanford video, to show us how you would do an exam via telehealth. And this is where we began to understand that telehealth opportunity is very broad. We did also create scripts in the beginning, and this was so that we would remember to tell the students up front what to do if the call disconnected. So here we are, telehealth now. We have continued to serve the student population. Our clinic has been open every day during the pandemic, seeing face-to-face appointments, but also providing telehealth appointments to our students that are located here and throughout the state of Florida. We are excited to continue our work with telehealth, and we hope you will join us in celebrating Telehealth Awareness Week, September 19th to the 25th, 2021. So your takeaways are that telehealth implementation takes the entire team to create an effective telehealth program. You really need to identify those internal and external stakeholders that will help you, to include your leadership. Telehealth implementation encompasses processes that occur before, during, and after the telehealth appointment. And satisfaction data demonstrate that telehealth is an effective way to meet student healthcare needs. Finally, telehealth is a vital technology now and into the future. I've listed for you several references. And here is my contact information should you have any questions. We will now enter into a live question and answer period where myself and my team will be available to answer any questions that you have on implementing telehealth at your organization. Thank you.
Thank you so much, Valerie and team, for your participation today. My name is Sherry Williams, and I'm the Chief of Operations at the Global Partnership for Telehealth. And we're delighted that you all joined today to listen to Valerie and her team talk about what they've been able to accomplish. It's quite an amazing feat. And I was listening to what you said about Ryan earlier. I will underscore that. Ryan is our hero at GPT. He is an amazing go-to guy for anything that we need done or any problem solved. So thank you, Ryan, for all your work. Valerie, we do have a couple of questions. Do you want to quickly introduce your team before we start?
Absolutely. So, and you can hear me still?
Yes, we sure can.
Okay, great. So in the team, we have Dr. Fred Beck. He is our medical director. We have Ryan. You heard of Ryan. Ryan, he is our medical informaticist. We have Hope, is one of our advanced practice registered nurses. We have Nadine in the background here as one of our registered nurses. We have a guest DNP student who will be doing some clinicals with us in the fall. We have more nurses. I have back here Megan, Dina, Julie, and your AC. Can't see her on the plate.
Well, thank you all for joining us today. So those in attendance, if you have any questions for Valerie or anyone that she just introduced from her team, if you will enter that into the question pane, we will make sure that gets answered live on air today. Valerie, we do have a couple of questions to get us started. The first question is, you talked about all the important steps to create a successful telehealth program. You mentioned putting together a telehealth team. Obviously, we're looking at your team now, but was there a decision making on who is going to be a part of that core team, and why did you make the decision based on those types of roles?
So that's a great question. I think everybody you have to think about your workflow when it comes to the patient experience, and anybody that the patient would see normally in an in-person clinic visit should be a part of that team because they're going to have input into that workflow that, from my perspective or from a nursing perspective or others that we don't necessarily see every day. So you have to identify all of those stakeholders internally. And then we actually learned from other technology implementations the importance of the importance of being able to work with our IT team. They're significant in this process, and so and I was new to the university, so I didn't know who was who, but we quickly learned that they were going to be our best friend in really implementing any technological solutions that we needed within the clinic.
Thank you. The next question that came in was, how did your students adapt to telehealth?
That's also a great question. So I think that they're still adapting. That's my opinion, and I'll open it up to my team to also put some input on this one, because they've certainly seen the students and/or interface with the students and in some of the most challenging ways, and helping the students learn how to use the technology. So what are your ideas, team, on how the students have adapted?
Yeah, I'd say it was kind of interesting because early on, as we were adopting it, I questioned every student after every visit, and what do you think about this, just to solicit their input. And almost uniformly, they liked it. One was over in Orange Park, so she would have had to cross the Buckman Bridge to come here, so then quite a haul for her to come, but it was pretty unusual that you heard anybody's voice say dislike, for the process. In fact, I don't think I heard a single person say they didn't like it. There were some that said, well, maybe if I'm not better, I might like to come in person and that type of thing. But I'd say pretty consistently there was acceptance.
So
Oh, go ahead.
I'm sorry. Does somebody else want to answer?
Any other feedback? We were before this started, we were laughing at some of the experiences because students have their own idea of what how they should show up for their medical appointments, and some did not want to turn their cameras on because they weren't fully dressed. Some were, like I said, walking, driving. Some were sitting next to their friend, or girlfriend, and so it became it was quite challenging, just to work with them. But you solicit their permission. I mean, if they want to have this appointment with, I guess, their person next to them, then okay.
I had one thought on this in terms of students adapting, and I would say whenever I was troubleshooting with a particular student, a lot of them were extremely patient, extremely willing to go through the process. I would say, could you switch from your phone to your laptop, or could you hit refresh on your browser? And they'd all be very willing to, to hop in there and kind of do whatever it took to get, access to the video feed.
I do think they tried to use their cell phone a lot in the beginning, but it just sucks down the drains the battery really fast. And so we really began kind of advertising to please be on your laptop with that. I think even our front desk personnel might even remind them of that. So, and that's very helpful.
So on the flip side to that question, we want to know, how did your staff adapt to telehealth? Did you have any pushback from the staff? Why do you think that occurred? And how did you overcome any of those obstacles? And since your team is here, I don't know if you want them to talk about their experiences or not.
Absolutely. All right, who wants to talk about their experiences?
I could talk. I definitely was really excited actually to have a way of offering our services to the students even during the pandemic. We were all worried how they would be able to get the proper care when they were sick if we were keeping them out based on their symptoms. So I think I have a pretty good background with computers and technology. So I knew there would be a learning curve to figuring out any kinks we needed to work out or ways that we could make the process go more smoothly for us on our end or on the students' end. But it didn't take as long, I don't think, as we thought it might, to really get everyone on the same page and have a pretty smooth process going. How did you feel, Hill?
Well, initially I was not crazy about it, but I mean, I thought I would not like it, but I ended up honestly liking it way more than I thought I would. And it was easier, and thanks to Ryan. He helped me with my technology skills, but so yeah, it was smoother than I thought it was gonna be.
I love hearing that.
The practice beforehand was crucial. I mean, I think everybody kind of starting to feel comfortable and familiar and kind of assuming the patient role as well. There are a couple of things that we kind of discovered, by virtue of being the patient that we wouldn't have if we were just purely clinicians. So, couldn't emphasize enough, become familiar before you get started.
And I'm sure Ryan, if he doesn't have gray hair before this all happened, he may have a few gray hairs now.
No, maybe just a couple. Not too many.
Okay, I have one more question. And if anyone else has any questions, please put them in the question pane and I'll be sure to ask those out loud. So we have a question. You mentioned students were invited to their appointments about 15 minutes prior to the scheduled appointment, so that the nurses could do an intake and transfer to the provider's waiting room. Are you saying that Pathways allowed for administrative functions within the platform and waiting room transfers?
So I'm not sure if I understand the last portion of the question, but I'll tell you what I do understand, and then I'll let Ryan speak because I know he totally understands it. You can type in the time that you want to invite them into the waiting room, and instead of inviting them the time of the appointment, and we did that for multiple reasons because we had students show up late, and then we had technology issues, and all of that would delay us. It would get that if you have a 20-minute appointment, they get to the clinician at 19 minutes, and then that would put them behind in seeing their next patient. So we figured if we invite them in earlier into the waiting room, then it would give us enough time to really troubleshoot anything that occurred, get all those that initial assessment and intake form reviewed, and then we can get them to the clinician right on the start of the 20-minute time frame.
Yeah, that's exactly what we did. Really, we had two separate systems because we had the Pathways invites going out with the timestamp, and we also have the Medicat EHR that we use. And so, for example, for a 9:20 appointment, we would send out the Pathways invite at 9:05, so that by the time the nurse, performed the intake, got the information into the chart, then the provider could pick up the call kind of right as if it were an in-person, patient showing up at the right time.
And that's something I'm glad you brought that up. That's something I didn't say within the presentation, but so our electronic health record is separate from the telehealth. So when we book the appointment in our electronic health record, it could be a 9 a.m. appointment. And as Ryan said, we would through the global through Pathways program, we would just pick then 8:45 or 8:50 to invite the student, and that's what they would see, even though they talked with us and knew they booked a 9 a.m. appointment. Apparently they're following, they don't remember the time or whatever. They're following the prompt that they get from the email and the text that we send through Pathways. But I hope that answered the question.
And that's good. That's a problem.
Yes, I think that answered. Thank you. One last question. And once again, if you have any additional questions, please enter them in the question box. Someone is asking about your after visit surveys. How did you get them to the students? Did it go out via text or email? What was your return rate? And then I'm going to add to it, what do you anticipate doing with the data you collect? Maybe a white paper coming out in the future?
Wow, no pressure there. We use Qualtrics, which is a survey program that a lot of universities use. It's kind of like, well, I mean, it's not SurveyMonkey, but anyway, it's our SurveyMonkey. And so we're able to use that and create a link that we can embed into an email. And since every student at our university has an N number, we can just push it out to their N number, their email that's associated with that N number. That particular data was collected by a DNP student who was that was her DNP project to get her earn her DNP. So I don't think that the N number was very large. Actually, I want to say it might have been 30 for the total respondents. Our normal satisfaction survey, which we do the same way. We send out, we'll identify all the students who have come through the clinic from like a June to May timeframe, and then we'll create that Qualtrics survey and send it out via email. They just click on the link and then they can answer online. So they could do it on their phone, they could do it on a laptop, whatever, and then it will collect into the system. And Qualtrics itself is it's awesome because, I mean, it's got a reporting function. It'll generate graphs and stuff for you if you like, or you can throw it into Excel and create your own. You want to add anything to that?
Yeah, I think that's really it. Yeah, we're using that Qualtrics tool, and the response rate is not great with email, but we get enough data that we can get some analysis done. And like Valerie was mentioning, there's a reports tab within the Qualtrics platform, and it can generate PowerPoint slides or PDF reports of the data that came in. So.
Yeah, with web-based or email surveys, you really have to layer in order to increase that and to get a solid kind of base for the data if you want it to be statistically valid. And Qualtrics actually does that. It'll send out repeat emails, and you can send it. I don't even know how many ours went out, like 5 or 6 times, right?
Yeah, you can schedule reminders by calendar date and automate that to go out. So it can be kind of a one and done thing to get everything out to the students.
And I honestly don't know. I'd have to look back at her DNP study to see, did she only do a 30-day window? How many times did she send it out to remind? But there's literature out there that, and I only know this because of the work I had to do for my doctorate, that talks about web-based surveys and, the layering effect that takes, so we also, I mean, you can use social media to push it out. You can use your, website. If you send out a newsletter, I mean, you just have to keep layering in order to get as many volunteer participants as possible.
And last thing, I think I was just going to mention that the data is stored permanently. So if research questions come up in the future, or we want to look at some particular aspect or question, we can always go back and look at the data as needed.
And we'll definitely repeat it so that we can see the trends over time with our telehealth. So maybe a white paper in the future.
Yeah.
Fantastic. Well, we are up against our last of our hour at this point. I don't see any more questions coming in. I want to thank Valerie and her team for the fabulous information and presentation that you all have given, and especially for all your work that you have done tirelessly since this crazy COVID pandemic occurred. I know you guys have worked really hard to make sure your students and faculty and staff still have access to the healthcare that they need. So you are much appreciated. You are true heroes. So thank you very much. To our attendees, I just want to remind everyone, when we close out today, a survey will pop up on your screen. We encourage you to fill out that survey. It gives us ideas on what topics to bring to you over the next coming months, and also a question about whether you want CEUs. So if that is a yes, please answer that, and we'll make sure you get your CEU for today. If you haven't done so already, you can visit our website at gpth.org. click on the media tab and take a look at our upcoming webinars. Dr. Ann Patterson and Dr. Jennifer Birkin will be presenting on July the 29th pertaining to telehealth and obstetrics and gynecology. So we would encourage you to join that as well. Today's webinar has been recorded and it will be posted on our website under the media tab also. So you can look for that in about a week or so. That should be available. And should you have any questions about telehealth, my staff is here to help you, and so is Valerie's. We thank you and have a wonderful day.
Thank you.
So Mallory, what are we gonna do?